So we spend a third of our lives in the bedroom either sleeping or trying to sleep. And when it comes to physical wellness, sleep is as important as a good nutrition or a good exercise. Do you feel like you had enough sleep last night? Do you think that your quality and quantity of sleep is enough? That's our topic for today's video. Stay tuned. Hi friends, Atem here from Sapphire Space, where we discuss all things wellness and self-improvement. So our question of today is, how much sleep did you get last night and how much sleep do you get overall? Most importantly, how much sleep do you think you really need? So if you don't know, keeping track of our sleep schedule is actually supposed to be a top priority because, like I said earlier, we do spend a lot of time sleeping throughout our lives. And if you don't get enough sleep, it's going to be very detrimental to your health because sleep is obviously crucial to your health. So according to the American Academy of Pediatrics and the CDC guidelines, there are different sleep recommendations based on your age. So people aged from anywhere between birth and 3 months, they need about 14 to 17 hours of sleep. 4 to 11 months need about 11 to 14 hours of sleep. 3 to 5 years need about 10 to 13 hours of sleep. 6 to 12-year-olds need about 9 to 12 hours of sleep. 13 to 18 years need about 8 to 10 hours. 18 to 64, which is most of us, need about 7 to 9 hours. And 65 and older need about 7 to 8 hours. These guidelines are also very similar to the National Sleep Foundation. So make sure you're checking amongst yourselves as you're watching this video and asking yourself, am I getting enough sleep as it is required? If no, there are different things that you should consider changing in order to make sleep a priority. So this is just part one of my sleep series video, and I will definitely be bringing up more content in the next coming weeks regarding sleep, because again, sleep is very important for all of us. So what are the signs that you may not be getting enough sleep? So some signs of sleep deprivation includes you feeling drowsy throughout the day, you feeling really irritable or moody depending on the situation, you feeling less productive and less focused, you having an increased appetite, or having issues with your judgment, like having poor judgment or poor decision making. The final one is your skin being affected. So if you notice, a lot of people who are sleep deprived tend to have dark under eye circles or generally have a dull or pale looking skin. So this is the best way you can know if you're sleep deprived or not. Most importantly, sleep deprivation can definitely affect you mentally, and this will affect your ability to think clearly, your ability to focus. It's going to slow your reaction time. It's also going to impair the way you're able to control your emotions. So with those points, you definitely should understand that sleep is very helpful and vital for our survival, for our well-being. So chronic sleep deprivation has been shown to increase the risk of different conditions, especially diabetes and heart diseases and obesity, which is like a pandemic, and also depression. Sleep can also affect your body immune system, and it will reduce the way or the rate at which it fights infection. Sometimes patients do have sleep disorders that are actually preventing these patients from getting a good night's rest. It's very different if these sleep disorders are occasional. Examples of occasional sleep disorders are if you are having any stress that is temporal, if you're having any jet lag, or if you have a really busy and packed schedule. Those ones may temporarily affect your sleep. But if you notice that your sleep is basically chronically affected day in, day out, then it's something that you probably or absolutely have to see a provider or a medical doctor. Certain examples for this is insomnia, sleep apnea, narcolepsy, restless leg syndrome, and parasomnias. These diseases should definitely be treated. So if you think or you suspect any of these diseases, please make sure you're speaking with your healthcare provider. Also, please note that your sleep quality should be as important as your quantity because it will make sense if you went back to bed for like 9 hours and did sleep for all 9 hours, or at least for most of the 9 hours, versus going to bed for 9 hours and only sleeping for an hour out of those 9 hours. Sleep is something that is really good to revive and renew everything in your body and mind, and it always gives this feeling of calmness and peace. And that's why I sometimes don't blame people who like their beds and are somewhat addicted to sleep, because the feeling that sleep gives you is next to nothing. Like, some of you can vouch for this. So the moment you're sleeping, that's when your body realizes that they're going to shake off all the tiredness and the stress for the day and get your mind and body ready for the next day. And when you're enjoying a very comforting sleep, all of your body functions are regulated and your memories are stored, and your mind is getting ready to welcome new memories on the next day. Here are some more benefits of sleep that you should consider thinking about anytime you want to stop or prevent yourself from this goodness. So sleep definitely helps you maintain crucial body functions. It helps you restore your energy. It helps you repair your muscle tissues, and it helps allow your brain to process new information the next day, because if you don't sleep, you cannot convert your memory from the short term to a long term. Sleep will also reduce your inflammation, and it has been shown by different studies that sleep loss actually causes inflammation, which can lead to different diseases, chronic diseases, especially like cancers and irritable bowel diseases, and really many others. Also, people who have adequate sleep are more likely to be productive and have better performances and memory, and generally improved concentration versus people who are chronically sleep deprived. Most people who sleep adequately tend to eat fewer calories, because when you have a sleep deprivation, there is this mismatch or imbalance of your chemicals that's responsible for regulating appetite. So this can lead to overeating, and can also lead to obesity and weight gain, which is something that we should try to avoid or stay away from. And poor sleep obviously increases your risk of chronic problems like cardiovascular diseases, high blood pressure, and stroke. And healthy sleep will reduce all of this risk. There's also a reduced risk for depression, because a lot of people who are depressed tend to report lack of sleep as well. And if you get adequate sleep, you reduce your chances of being depressed. So that brings us to the end of this video. I promised at the beginning that I'm going to be making a part 2 of the sleep series, and in part 2 we will discuss the different stages of sleep and how to get to those different stages. So that basically includes different tips and hacks to fall asleep and stay asleep. So I hope you watch up to this point. If you did, thank you very much for watching. Please make sure you like and comment. For the comment of today, I just have this one question of the day. Don't forget to check out my previous videos in my channel, and when you click on those videos, I will see you over there. Thank you so much for watching.